This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and my client presents with 7 years of low back pain, and she's seen a pelvic floor PT in New Jersey who suggested that she look me up since she was coming out to Aurora, Colorado, as her husband has a conference here. And hip range of motion is beautiful. Excellent in all directions, no pain provoked. Pubic joint is symmetrical. Pelvis is just a little bit asymmetrical. It's rather subtle, but this right pelvic bone, the ASIS, this bump, is a little more forward and it's a little bit lower compared to the other one. And this is just a visual examination, and the shelf is lower as well. Something interesting happens when I try and get it to move, but we're going to move this side of the pelvis first. So I'm going to push it at a 45-degree angle, and you'll notice the pelvis moves, okay? And there's a little delay before you see the opposite side come up, and the opposite side comes up only just a little bit, and it comes to a natural stop point. And then I add a little additional force and I get a little bit of rotational mobility. So this is normal, and it springs back. Okay, I can thrust it forward, I can spring it forward, and it bounces back like a spring. On this side, immediately the other one raises. And the motion looks like it's traveling transversely instead of kind of obliquely or in a rotational, posterior rotational manner. You know, I'm trying to get this right side of her pelvis to rotate posteriorly, but it looks like it just goes transversely and lifts this up right away. That's an indication that there's blocked motion in the SI joint and that the sacrum may be involved as well. I'll show you that when she's up and sitting, okay? The other hint that she might have a sacral torsion is that I have found that when people have a twist of their sacrum, in which it's side bent and rotated and has stuck mobility in one quadrant, what I have found is that there's a reflex in the body, and the upper T-spine and rib cage rotates to the right, so it counter-rotates. So I'm suggesting that she has a left rotation of her sacrum, and if we come and capture the rib cartilage, I'm probably on number 6. Maybe this is 5. This would be 4. And 3 is stuck. What does it feel like when I push on these?
Oh, it hurts a little.
Hurts a little bit? Okay, can you tell it's not moving?
Yeah.
And am I using similar force?
Yeah, but it hurts more.
Yeah, I'm actually using more force.
Okay.
Yeah, and it just isn't moving. And then the one above that moves. So I think that was number 3. That would make this number 2. And number 1 is under here. So I'm calling that rib number 3. And the thoracic segment also rotates. And that's a muscular phenomenon. So nothing's out of joint. It's not that. There's nothing out of joint in your sacroiliac joint. It's just moved through what's a normal movement, but it got stuck at end range. Okay, that's my belief. Okay? Let's have you lay on your stomach.
Mm-hmm.
So when we restore motion in the sacrum, then that thoracic rotation will just melt because it's a reflex. I've tested her in multiple directions, pushing up, okay, pushing forward, you know, springing it forward. I've done all manner of springing of the sacrum with her on her stomach, and she has good motion when she's on her stomach. But when she sits up and forward bends, that's when we see the asymmetry of the sacrum with the reduced motion. And the other motion that's blocked is this inferior motion, and I'm pushing with a fair amount of force. And on the left side with a lot less force, I can move it and it comes to a stop point, and then I can thrust it and it moves, it springs, and it recoils backwards. Okay? Let's have you sit up and face me.
Mm-hmm.
I'm sure the camera can't capture this asymmetry, but The upper sacrum is here, and I can impart spring through the upper sacrum on the right and on the left. And then we come to the lower sacrum, and actually if my thumbs come together, you can see that my left thumb overhangs by about 3/16 of an inch. I think the camera can capture that, and I can induce motion through your body when I thrust the sacrum on the lower right quadrant. And when I thrust this one and I double that force and really increase it, there's still no motion there. And that's called a sacral torsion. And if we come underneath the sacrum, okay, I can see and feel that my left thumb is lower, but I'm lifting up under the sacrum on both sides, and I lift up towards your ear, and I get a little bit of movement of your body, and I lift up on this left side, and motion is blocked in that left sacroiliac joint, so it takes considerable force for me to bypass that. So we're going to treat you, and it's very simple. I'll have you lie on your back. Go ahead and lie on your back. And I'm going to put my hand on your pelvis. So I put my hand under the sit bone, and then I capture the front of the pelvis, and I distracted the pelvis laterally. So I'm gapping your SI joint ever so slightly, and then I'm rotating parallel to the joint surface. Okay? So my direction of rotation is outward. Okay? So I'm inducing a posterior rotation, and I can feel that I can gain movement. So I'm just going to do this 10 times, and then I'm going to teach you how to keep that motion.
Okay.
Okay, so now leg out straight, and now I can take up the slack, and now I can spring it. So now that motion is restored. Okay? And then you're going to hug this knee twice a day and stretch outside the right shoulder. It's about a 20-degree angle, and you just stretch it gently, and you do that for 2 minutes.
Okay.
So for a week, let's do it twice a day. And it's a really good exercise to do anyway. So after that, let's do both sides once a day forever.
Okay.
Fair? Okay, good. Now the other thing we're going to have you do, I'm going to move the camera. The other thing we're going to do for your torsion is we're going to do a self-treatment. While I could mobilize your sacrum, it's just as easy to have you do it yourself. And so the self-treatment for that sacral torsion is to take a piece of foam, and you isolate your tailbone coming up the crease in the middle of your bum. So you find the tailbone, and then you put the foam right above the tailbone.
Okay.
The rounded part is against your body. Okay? Feet are wide as your shoulder, and your heels are about 4 inches forward. Okay? All you do is touch the wall with your shoulder blades, and you bend forward so your nose goes in front of your toes. Nose in front of toes.
Okay.
And you do this bending 10 times. Okay? And that will derotate your sacrum and reflexively free up your rib cage. So come over and give me 10 of these. I'll keep filming.
So, tailbone.
Very good. Perfect.
And then I just...
Yep, that's it. And touch the wall. Good. Give me 10 of those and then go lay down. I wrote a book chapter on sacral torsion.
Oh, did you?
Yeah, it's in the book called Dynamic Body by Eric Dalton.
Okay.
Good. You counting? I'm not.
Yeah, that was 10.
Oh, good. Good. Come lie on your back. So I'm going to test that rib first.
Mm-hmm.
So I'm below it, probably on rib number 6. 5, 4, I might be off by 1. And then that's your clavicle, they're all moving. Can you tell?
Yeah.
Is there less pain with that?
Yeah.
Good, good. Sit up and face me, please. And then just scoot over so you're not sitting in that crack and bend forward. And lean on your hands. So now you know how to treat yourself.
Woohoo!
And this is no longer prominent, and I can spring that freely. Okay? And then if I come underneath the sacrum, they look symmetrical to me. I'm under the ILA of the sacrum, which is inferolateral angle, and I can lift up easily, and your whole body moves. Okay?
Oh, cool.
So we're off to a good start. Thank you for letting us film. You want to move around and tell us how you feel?
I feel good. Yeah.
You're smiling.
Yeah.
What's different? What's different?
I don't really know.
Walk down the hall and back.
It doesn't feel as tight.
So it doesn't feel as tight, you say?
Yeah.
Excellent. Go sit in that chair and see how you feel sitting.
Oh, this feels more comfortable.
Sweet. So sitting is more comfortable as well. Nice. Wonderful. Well, I think this is going to be straightforward. You know. Yeah. And thanks for letting us film.
That gives me